Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Indolent systemic mastocytosis ISM treatment. Indolent systemic mastocytosis is a usually benign, noncancerous form of mastocytosis, a genetic blood cancer caused by abnormal mast cells. Mast cells are white blood cells produced in bone marrow. /R/N/R/N as its name implies, indolent systemic mastocytosis progresses slowly and does not present an immediate threat. Treatment for this form of the disease aims to identify and avoid symptom triggers. /R/N/R/N This disease causes excess abnormal mast cells that build up in organ tissue. When a trigger arises, these cells overreact and release too much of a chemical mediator, such as histamine, to fight off a perceived threat. The effect causes symptoms like an allergic reaction in the organs involved. Treatment mostly includes self-management and certain drugs. /R/N/R/N This article describes treatment for indolent systemic mastocytosis when it affects your skin or other organs. It also explains what to expect from flares and how to control treatment side effects. /R/N/R/N Williams Getty Imagesrnrn The timing and type of treatment you receive for indolent systemic mastocytosis can vary by individuals since the disease affects everyone differently. /R/N/R/N Indolent systemic mastocytosis has a better prognosis than other forms of mastocytosis. The disease typically spares organs from damage and rarely progresses to the more severe forms. People with this condition generally live a normal lifespan, comparable to their peers. /R/N/R/N However, it can be highly symptomatic. In addition to physical symptoms, psychological and neurological symptoms that lead to reduced performance can also occur. Symptoms that interfere with physical and/or emotional well-being warrant treatment. /R/N/R/N Even if symptoms are minor and medical treatment is not needed, guidelines from the National Comprehensive Cancer Network, NCCN, advise that people with indolent systemic mastocytosis should receive the following. /R/N/R/N You have a higher risk of symptoms of anaphylaxis, a severe and potentially life-threatening allergic reaction, if you have any form of systemic mastocytosis. This medical emergency can occur when histamine levels in your blood quickly and intensely increase due to an abnormally high number of mast cells overreacting to a trigger. /R/N/R/N Symptoms of anaphylaxis can occur within seconds to minutes of exposure to a trigger. They require immediate treatment with an EpiPen and a visit to a hospital emergency room. Common signs of anaphylaxis include :/R/N/R/N There is no single treatment for indolent systemic mastocytosis limited to the skin. The specific treatment you receive will depend on many factors, including the extent and severity of your disease, your age, medical history, and other health conditions. /R/N/R/N The primary goal of treating ISM limited to the skin is to control symptoms caused by mast cell mediators. When therapy is needed to control symptoms, common treatments include /R/N/R/N FirstLine Therapy /R/N/R/N First Generation and Second Generation H1, Histamine 1, Antihistamines are the cornerstone of first-line therapy for indolent systemic mastocytosis limited to the skin. These drugs often succeed in relieving symptoms of pruritus, itching, facial flushing, and burning of the skin. /R/N/R/N Common first-generation H1 antihistamines include /R/N/R/N Second-generation antihistamines may tend to cause less drowsiness than first-generation drugs. Common second-generation H1 antihistamines include /R/N/R/N For persistent symptoms, treatment may be expanded to include the following medications: /R/N/R/N H2, histamine 2, antihistamines, /R/N/R/N leukotriene inhibitors, /r/n/r/n Other Therapies, /r/n/r/n SecondLine Therapy, /r/n/r/n SecondLine Therapy is used for skin symptoms that are not responsive to first-line therapy, /r/n/r/n There is no single treatment plan for indolent systemic mastocytosis because this disease affects everyone differently. Treatment for this disorder is mostly based on expert opinion rather than evidence from controlled clinical trials. This is partly because it is a heterogeneous disease that can affect a combination of body systems, but only involves about 1 per 10,000 people. /r/n/r/n Indolent systemic mastocytosis involves at least one organ system other than the skin. Since few cases progress to advanced forms of the disease, treatment focuses on improving and preventing symptoms related to mediators such as histamine. Other treatments may be used for more advanced forms of the disease. /r/n/r/n Some common treatments for indolent systemic mastocytosis include /r/n/r/n Neuropsychiatric System /r/n/r/n The following treatments may help with brain fog. /r/n/r/n Cardiovascular System includes the use of EpiPens, which treat low blood pressure that may be spontaneous or observed after an insect bite or other trigger. /r/n/r/n Respiratory System /r/n/r/n The following treatments can help with respiratory symptoms such as wheezing and shortness of breath. /r/n/r/n Leukotriene inhibitors /r/n/r/n Musculoskeletal System /r/n/r/n The following treatments center on treating symptoms of osteoporosis, loss of bone density, and bone pain. /r/n/r/n Digestive System /r/n/r/n The following medications may be helpful in treating gastrointestinal symptoms. /r/n/r/n Whole body system /r/n/r/n The following treatments can provide benefits for your entire body. /r/n/r/n While traditional medicine can help manage indolent systemic mastocytosis, some people report success with alternative or herbal treatments. Though scientific research is limited, there is anecdotal evidence that consuming the following anti-inflammatory foods and herbs may help symptoms of the disease: /r/n/r/n symptoms and secondary conditions of indolent systemic mastocytosis can run in severity due to the heterogeneous nature of the disease. /r/n/r/n Many symptoms are episodic, becoming intense in unpredictable, recurrent flares that occur in response to triggers or for seemingly no reason at all. Since the disorder affects everyone differently, you may not know which organs will be affected or how you will react until symptoms begin. /r/n/r/n In addition to treatments specific to symptoms, some people succeed in working to avoid known triggers at home, at work, and in their social lives. However, since triggers can range from temperature variations to the development of new allergies, avoiding triggers can often affect how you live your life. /r/n/r/n You may be able to help control flares by following a strict low histamine diet. This diet restricts eating foods high in histamine or foods that may increase mast cell histamine release. This can help avoid adding to your body's existing levels of histamine. /r/n/r/n High histamine foods include those that are overly processed, fermented, or spoiled. Examples of high histamine foods include /r/n/r/n Managing symptoms can also help reduce your risk of complications and secondary conditions. Common comorbidities, co-occurring conditions, with ISM include /r/n/r/n Limiting or avoiding ISM treatment side effects requires communicating with your care team so they can help you manage these issues. Finding the right treatment regimen can be a complex process. /r/n/r/n Factors such as the rarity of the disease and a provider's unfamiliarity with it can complicate treatment. In some cases, it can contribute to a delayed or hindered diagnosis, impacting side effects and treatment outcomes. /r/n/r/n While an allergist or immunologist may help you get a proper diagnosis of indolent systemic mastocytosis, the NCCN advises that treatment of all types of mastocytosis ideally includes a multidisciplinary approach involving the following specialists. /r/n/r/n This team of specialists works together to address side effects and treatment changes from all aspects of the disease. /r/n/r/n Side effects of ISM treatments can vary by type and disease. Common side effects include /r/n/r/n Side effects of ISM treatment add to the unpredictability of the disease and the wide range of invisible and visible symptoms it can cause. While your healthcare team can help you manage many side effects of treatment, research indicates that people with systemic mastocytosis have also used the following strategies to face these challenges. /r/n/r/n Indolent systemic mastocytosis can present with many types of symptoms. These can range from mostly skin-centered to systemic problems such as flushing and bone pain. The risk of anaphylaxis is also higher than normal. /r/n/r/n Treatment for indolent systemic mastocytosis centers on easing mast cell mediators and their impact on affected organs. Most people with this disease can expect to live a normal lifespan with little risk of severe disease. However, symptoms need proper treatment to maintain comfort and a normal life. /r/n/r/n Finding the right treatment can be challenging for this rare and heterogeneous disease. While an allergist or immunologist may manage your care, having a multidisciplinary treatment team is advised. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.